Every baby has a different temperament. Some are naturally fussy and others are naturally calm. And if you have a fussy baby, then you're pulling your hair out trying to figure out what you can do to help them calm down. It's a fact that most babies are more fussy between 6 p.m. and midnight, just when we want to be calming down and going to sleep or trying to get things done. And colic can onset anytime between 2 to 4 weeks after birth, and crying usually peaks around 6 weeks. So the fact that your baby's 6 weeks old is a good thing. Hopefully you're on the downslope. But it can persist for 3 to 4 months, and in rare cases even 6 months. No matter what your baby's crying pattern, if you're noticing that your baby is crying more frequently than you would have thought, it's feeling abnormal to you, or your baby is inconsolable when they cry, it's best to have them checked out by the pediatrician. The pediatrician can ask you more specific questions about it, perform an exam, and then decide if any medical treatment is necessary. In some cases, it is due to things that can be treated. In other cases, it's just things that you need to learn how to cope with and work with your baby. And there are a couple of things that you can do to help soothe your baby. Babies like noises. So anything like we all have heard about the vacuum and the sound of a dryer, or ambient white noises, fans, or noise machines. Even some babies like those kinds of things, and it will calm them down. Rocking babies can help, or going for a walk, putting them in the stroller and walking. Some babies like car rides, although I don't recommend putting your baby in the car in the middle of the night if you're tired. That's not safe for either of you. You can also try swaddling your baby because they like that. They're used to being tight from being in the womb. And, if all of these things fail, then you can try eliminating certain things from your diet if you're breastfeeding. Things like chocolate, caffeine, and dairy products can be common culprits of gas and pain and bloating in babies. And so slowly eliminating those things from your diet may help. A lot of people have said, oh, if I eat spicy food, my baby gets so fussy. But they've done studies to show that babies in countries where spicy food is eaten all the time aren't any more fussy than babies in countries where more bland foods are eaten. So, those things may or may not contribute to your baby's fussiness. Although when you're at your wit's end, it's worth trying anything. If you're formula feeding your baby, the doctor may recommend a change in formula, but don't make any changes in your baby's feeding until you've talked to the doctor and it's recommended by them. Always remember that you are a responsible parent, not a bad parent, if you feel the need to put your baby down while they're crying. If you're feeling yourself getting very anxious or angry while your baby's crying, just put them in their crib, because if they're crying, they're okay. And it's okay to let them cry for a few minutes. Stay close, listen to them, make sure that the environment that they're in is safe. And if that's the case, it's okay to just go relax and gather yourself and come back when you feel like you're able to handle the situation again. And call on family and friends to help you, because we're never as annoyed by someone else's crying baby as we are with our own, because when it's our own, we feel the need to comfort them and we can't do anything about it. We feel very helpless, and this adds to anxiety and frustration. Good luck with everything. I hope these tips help you. And if you have any other questions for me, feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.